Hello, hello. Happy Monday, everyone. This is Ms. Rochelle, and welcome to Track 2 Group Study. And tonight, we are going to be practicing solving scenarios from cardiovascular system. So I want to know how you are, and are you ready for tonight's class? Let me see who's here. Good evening, Lavon. Hi, Miss Patricia. Yay, I'm so happy you're here, Miss Patricia. How are you? Hi, Miss Kelly. I've been expecting you, Miss Kelly. Good evening, Katoya. How's your weekend? Did you all enjoy some, good time outside? I heard it's quite hot and somewhere in US right now. We are lucky over here in Louisiana. It's kind of cooling down. I just told the ladies earlier I think we're on 85s or something. So I think I'm lucky today, but I hope you all are good. Let me go ahead and introduce my wonderful team over here. Let's start with Miss Angela. Hi, Miss Angela. How are you tonight?
Hi, Miss Rochelle. Hi, coders. I'm good. I hope everybody's having a good day.
Yes, same goes to you, Miss Angela, and thank you for being here. Miss Angela is going to help us out tonight with the reading, and also she's going to hang out in the chat with you guys. So go ahead and say hi to Miss Angela. And with a pleasant surprise too, we have a wonderful guest, and I always enjoy having her in class. So, hi, Miss Josie. Thank you for being here. And how are you today?
Hi, coders. Hi, Miss Rochelle. I'm doing great. How are you? Glad to get started on the cardiovascular system today.
Yes, yes, I am too because it's been a while. I feel like, and I love being group study with you guys. So thank you, Miss Josie, for your time, and we're gonna have a great class tonight. So, coders, are you all ready? Let's go ahead and get started because I want us to get to our scenarios tonight. So, if you are from our partner student, I want to welcome you all. Again, feel free to interact with us in the chat. If you are on your phone, you can see that question mark button there. That's where you can reach us. Just say hi so you know where to find us over here. Um, and I think if you're on your computer, you can just go ahead and say hi on the chat. I think it's a chat, right? I kind of forgot. Think on the chat on your panel. So I want to welcome you, and this is our group study, and everyone is welcome here. I want to feel everyone to feel it's going to be a relaxed class, not like we always do in our regular classes. So go ahead and try out our scenarios. Don't feel bad if you make mistakes. That's what we're here for. And like I said, we're going to have a great time tonight. So welcome, welcome. I'm going to go ahead and get started with our copyright. CPT is a copyright of American Medical Association. All rights are reserved. CPC is a registered trademark of the APC. We have keyword concept, FTR Chan, AMCI 57, flip and tap. They're all trademarks of AMCI. All right, so I think we're gonna start off easy. I have a few midterm questions for you tonight, and then we're gonna have ICD-10 lookup code, and then we're gonna dive into cardio. So I hope you're gonna enjoy that. I'm gonna try, and actually I'm gonna give you the first one because it's just easy. So let's start with, again, midterm. Medical term pertaining to the heart and kidney is called is it cardiorenal, B, angiomegaly, C, cardiomegaly, or is it valvuloplasty? And I'm just going to keep an eye, you guys, in the chat. I know you're going to rock this one. All right. Did everybody get their answers in? And I was absolutely right. I think you all rocked this. Everyone is agreeing on A, and indeed that is Correct. So great job, coders. All right. So next up, we have a little bit of A and P, I think, here. And would you like to read this one, Miss Josie, if you're available, please?
Sure, sure, I
Thank you.
will. Okay, coders, your answer are A, bundle of his and the electrical system, B, Purkinje fibers and bundle of his, C, heart valves and Purkinje fibers, or D, electrical system and bundle of his. Your question is, the conduction system contains pacemaker cells, nodes, the blank, and the blank. Wow, coders, I'm really impressed. I see some really good answers in the chat, Miss Rochelle.
Yes, this is very impressive. Great job. And thank you, Miss Josie. You got it, Miss Patricia, Elaine, Lavon. Yes, Tracy, you got it. Did everyone get their answers in? I just want to make sure. And I think, a really nice looking illustration for you guys. All right. Okay. It seems like everyone got their answers in. So let's take a look. The answer here is going to be B. So your electrical conduction system is, a system of the heart that transmits signals generated usually by the sinoatrial node. It starts from there and transmits, or to cause, actually, basically, it's going to be like a, I would say, like an electric, not really shock, but they're just going to stimulate your blood from your sinoatrial node to cause contraction of the heart muscle. So during a pacemaking signal generated in the sinoatrial node travels through your right atrium over here to the atrioventricular node over there, along with a bundle of His. So this is part of your conduction system, of course, your bundle of His. You also have it there. I think I have my highlight there. And then through the bundle bunches to cause contraction of the heart muscle. This signal stimulates contraction first of the right and left atrium and then the right and left ventricle. So this process allows blood basically to be pumped throughout the body. So pertaining to our question here, so the part of the cardiac conduction system would have to be, of course, your Purkinje fibers, as you can see there, and the His and the bundle of His. I always say bundle of His bundle or bundle of His. I think I always see it as bundle of His, but in this illustration is saying His bundle. So whatever you choose, but definitely those are part of your conduction system. Now, bundle of His is, of course, that's a part of a conduction system, but don't be fooled, because electrical system is actually, well, it's not even electrical cardiac system, so it's not even this, but I'm assuming that's what they're talking about, and they're talking about a system. Pay attention to your question. It's only asking you, which part, what are the part of the conduction system. I think I'm confusing you in that one. Also, the heart valves, of course, is not part of the conduction system. That is actually part of your heart. Okay, that's the valve there. And electrical system, like I said, is talking about the entire system. So if we're talking about part of the conduction system, it will have to be the Purkinje fibers and the His bundle. So you might How to try it first. Are you ready with us, Miss Angela? Let me know if you're here. If not, I can read it for you. Okay, I'm just going to go ahead and read it. So let's try this one, coder. So we have A, which side of the body is affected? B, whether the patient has gangrene. C, the state of gangrene. Or D, the state of your PVD. So the question is, what information is required to accurately code PVD with diabetes in ICD-10-CM? And I'll give you about 2.5 minutes to solve this. And okay, and the time is set, and you can begin, coders. All right, coders, let me see here. Did everybody get their answers in, or do you need more time? Let me know in the chat. If you need more time, that's okay. I think I only have about half of you answered yet. So I'm just going to give you about 30 seconds, okay? And then I'll be back and set the time. I'll be back in 30 seconds. All right. That's it. Whatever you are, your lead is, go ahead and put them in the chat. Remember, we cannot take too long for an answer. Don't overthink it. And don't worry, I'm going to show you how to get to the answer to this one, okay? So if you answered, so the keywords would have to be the PVD with diabetes. And that leads us to answer B. Yes, I know. I think some of you got this correctly. Great job. But I'm seeing a lot of these coming through too. So let's see how we come up with B, okay? So the first thing we have to do is, in order for us to identify how you would code peripheral vascular disease, is we're going to have to look it up in our index. So basically, this is a code lookup question. So let's go ahead and go there. So as we know, peripheral vascular disease, that's your PVD. So the first thing, we're going to have to look up index and what would be your main term. So I'm actually going to walk you through this. If you forgot about your ICD-10, so go ahead and walk with me. So our index, where do we start? What would be our main term? So let me know in the chat. I didn't see anyone following yet. So, or maybe I am lagging. Okay, I'm seeing one. All right. So we're starting off with disease, okay? So remember your main term, the one that's doing something, or the diagnosis, or an acronym. So we're going to start with disease and go right down to vascular, where you can find the peripheral, and in diabetes mellitus, which would give us a default. Well, actually, it's telling us to see E08.E13. So we're going to have to go there. So this is your tabular list now, and we're going to verify it. E13.5. So this is your codes, or these are your subcategory codes for other specified diabetes mellitus with circulatory complications. And if you can see, the green bold there is telling us about peripheral angiopathy without gangrene and a peripheral angiopathy with gangrene. So basically, when you go back to your question, it's asking us what information is required to accurately code PVD with diabetes. So remember, we went to our index, we're given our default code here, and we confirmed it, but then it requires 5-digit codes, 5-digit codes in order for you to code specifically what you need, okay? Are you guys following on that one? And since you need to identify them, so what distinguishes one from the other? Can you guys tell me right now that you see this? Because E13.51 is actually coding for other specified diabetes mellitus with diabetic peripheral angiopathy without gangrene, and the other one is with gangrene. So that's the answer to your question. So the answer to this, the information that required for you to accurately code PVD is going to be whether the patient has gangrene or not. Because if it has no gangrene, then your code would be E13.51. If the patient did have a gangrene, then your code will be E13.59. And if there's no complications, then that would just fall on E13.59. All right, but distinguishing information that is required here is the gangrene. So the answer is B. All right, so do you have any questions? Let me know before we move along. And I think we're going to get started on the cardio on next one. Got it? All right. Awesome. Sounds good. Okay, so let's go ahead and get started then. And oh, I had the coding path there if you need it. By the way, if you want to screenshot. And we're moving along. And let me see. Are you back here now, Miss Angela? Or she might be muted. Or Miss Josie, if you're still here, Miss Josie, would you like to read this scenario for us, please?
Sure, I can help.
Thank you, Miss Josie.
You're welcome. We have your answers first. A is R11.10, R11.0, and E86.0. B is R11.2, E86.0. C is E86.0, and D is R11.14. A patient is seen in the ED for nausea and vomiting that has persisted for 4 days. The ED physician treats the patient for dehydration, which is documented in the patient's record as a final diagnosis. In ICD-10 CM codes, what ICD-10 CM codes are reported for this encounter? Coders, we're going to give you 2 minutes on this one. You may begin.
Okay, I think they got all their answers are in now, Miss Josie, and they actually rocked this one. So,
Oh, they sure did. They sure did. Sorry, I was
yeah.
looking at a question one of the coders asked for us. There it goes.
Okay, I'll I'll
Thank
I'll
you.
try and get to that. Thank you, Miss Josie. And yep, I think we had a 100% on this one. And I kind of bummed a little bit. I thought it's gonna be CPT, but hey, more practice for ICD-10. It looks like. And like I said, you all rocked it. So let's just go quickly. We have nausea, vomiting, dehydration as your final diagnosis. So that leads us to answer C, of course. Because, as we know, when we use signs and we cannot use our signs and symptoms if there are definitive diagnosis code given, and in this particular scenario we are given dehydration as our definitive diagnosis, so that would make a wrong be wrong because we're coding for signs and symptoms, and your answer is just have to be E86.0 for dehydration. So great job, coders. Dun, 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 dun. Okay, here we go. As promised, CPT. Let's get it done now. So I think Miss Angela is here. Would you like to read this one for us, please, Miss Angela?
Yes, of course, Miss Rochelle. Okay, so we have A 36415, B 36592, C 36591, and D 37799. A 35-year-old female patient with a venous catheter requires a blood sample for hematology testing. The sample is collected via her PICC catheter. How would you report this procedure? And I'll go ahead and give you guys 2 minutes. What do you think, Miss Rochelle?
Let's start with 2.5 minutes, I think, and then we'll go from there. Thank you, Miss
Okay,
Angela.
2.5 minutes it is. I'll go ahead and put the timer on right now. Good luck, coders. And that's time. I'm seeing some great answers, coders.
Yes, I agree. Thank you, Miss Angela. I'm seeing a lot of cheering here in the chat, which is good. I like that. Okay, did everybody get their answers in? Go right ahead. Do it now because you don't want to miss this because I think we are riding on an amazing rock and roll train. Everyone is on board with this one and we all agree to one answer. Great. Okay. So we have, as far as our keywords goes, 35-year-olds. We have venous catheter. We have blood sample hematology testing collected via PICC. That's your peripherally inserted central catheter. And I actually have a good illustration that I'm going to show you. Hopefully when we get to that scenario later on. So you might like that one. So if I look at my answers here, I don't really have anything to go from. All of them, it has to be looked at. So, but the answer is B, and you already know that. So great job. We all agree on that one. So really, if you look at 36415 there, that's a collection of venous blood by venipuncture. So if you went on and highlighted your keywords, we know that the sample hematology sample was done via catheter. Okay, so not venipuncture. So that makes that A answer wrong. 36592, that's a collection of blood specimens. So we're looking for a blood sample there using established central or peripheral catheter. Okay, boom, that's where our keywords are. So it fits. Venous, so we know that this is a venous catheter, not otherwise specified. So we really like this 36592. And if you look at those parenthetical guidelines, it's telling us for blood collection from an established arterial catheter, use 37799, meaning to say that if you were coding for an arterial line, then 3799 would be your code. So that actually kind of eliminates D as well because, hey, we know that we're coding for venous catheter. So D, unlisted procedure, is going to be wrong. 36591, this is for an implantable venous access device. So we can eliminate that as well. So great job, coders. We all got this. The answer is B. Woohoo. Do you have any questions though before I move on? Want to make sure everyone is good. And we're going to try some scenario about pacemaker and defibrillators. Okay, doing good so far. I'm seeing a lot of got it's here. So good. So let's get ahead and let's try this one thing, this scenario out. And I think it's gonna be you, Miss Josie, if you're still in for it. Would you like
I
to read?
am.
Thank
Sure.
you.
Okay. Here we are. Here's the answers. A is 33244, 33241, modifier 51, 33240. B, 33262. C, 33236, 33202, modifier 51, 33206, modifier 51. D, 33241, 33240, modifier 51, 33233, modifier 51. A patient required a battery change for a single chamber pacing cardioverter defibrillator system. The battery was taken out in a subcutaneous fashion and a new battery placed. The cardioverter defibrillator was then reattached to the electrodes, which were intact and tested, and the skin pocket was then closed. How should these services be reported? We have your time is 2.5 minutes. Ms. Rochelle, I don't think we need any more time because I think everybody has the answer here.
Yes, I am so impressed. Thank you, Miss Josie. And I was actually looking at a poll because I remember nobody chose. When I asked which section, or Miss Angela asked which section of the cardio do you find most challenging, and nobody actually chose pacemaker defibrillator. So you know what, coders, I believe you because you definitely are rocking this scenario. So yay! So impressive. All right. Looks like you don't need me for this, but let me just do my job here. So let's go over our keywords. We have battery change, single chamber. We have cardioverter defibrillator. Definitely, that's our keywords. We have battery taken out, subcutaneous fascia, new battery placed. We have reattached electrodes, and we're talking about skin pocket was then closed. Now, if you notice, I went right into my keywords because I can distinguish the codes for the defibrillators and the pacemakers now. So I think you guys are too. So that's definitely why you're following my FDR. And I actually like to notate my, the answers to my FDR. So with pertaining to what, I know that I'm coding for a replacement of a battery for a defibrillator, and I'm looking for a single chamber, and the approach was subcutaneous. So I always like to tabulate them. Makes it easier for me to look up my codes later. So that all leads me to answer B. So I agree with everyone. I think most of us did answer B. So great job. If you missed it, don't worry. So let's go ahead. Let's have another look at this, okay? Now, I do have to say that when you're coding for this code ranges especially, it's really helpful to read those parenthetical guidelines because there are a lot of changers there. And believe me when I say again that you are going to be tested on those. So that being said, we know that we are here for battery change, right? So first things first, if you look at 33236 over there, that's kind of the oddball there. So this is a removal of a permanent epicardial pacemaker. So that's definitely go ahead. We're going to eliminate that because right now we know that we're coding for a defibrillator. So that easily, we don't even need to look through all these codes. You have already eliminated C. So that saves you so much time. Now, moving forward, we have 33240, okay, which would lead us to 33241. But this 33240 there. You can find it on A. This is the insertion of the inflatable defibrillator pulse generator only. So, okay, that's battery. So, but what happened? There's a battery change there. So that really doesn't, complete the story of it. So let's go ahead and take a look at the rest of the codes from A. 33241. There is your removal. Okay, so you have an insertion and then, well, basically you have your removal and then you have your insertion. Both of them are for defibrillator, pulse generator only. So are we able to do that? Well, like I said, you have to go and read on your parenthetical guidelines because it's actually telling us here you do not report 33241 in conjunction with these codes, and that 33240 code is right in there for removal and replacement of the implantable defibrillator pulse generator, because it's telling you this is going to be wrong, first of all, because once it's telling you to do not report, then you do not report them together. And same goes as D because it has the same codes there together, so that's eliminated. And why is that? Because they have a specific code for it. For removal and replacement of the implantable defibrillator pulse generator, you will have to look at this code range. So see how important that is? And I think everyone did that. So let's go ahead and take a look. So we're going to have to look at 33262. That's already a good lead. But of course, we like to confirm. So this is the removal now. 33262, that's your code removal of implantable defibrillator pulse generator with replacement of an implantable defibrillator pulse generator, and this is your single lead system. So remember, it did mention about a single chamber, and it does include the single chamber already. So that means that you do not need any other code for battery change. As long as it's for single lead, this is going to be your code. If you're coding for a dual lead, you have your code right there, and for multiple leads. So pertaining to our scenario, again, we're coding for a single lead, so that falls on B 33262. And if you want to go right in here, as you know me, I like to use the charts. It's really helpful for me, makes it easier. As long as I have my answers to my FTRs, I know what I'm looking for. If I go down here, remember we shunned this in class. These here are for insertion, initial, and then these are for removal. So you can actually find that there are two: removal of the pulse generator with replacement. So that sums it up as a replacement there. Only single lead system includes transvenous or subcutaneous defibrillator lead. Oh, this is wrong. Hold on, this is not my code. 33262 is, let me go look at my, this is actually wrong. I was like, that's not it. Where is my 33262? This is there. It's right. I'm looking at the pacemaker. Sorry, you guys. That was me. My bad. It is actually in the right lane, but we have to look at the defibrillator. I was looking at the pacemaker. So see that? Even I make mistakes sometimes, but always make sure to look. The first column is your pacemaker. The second column is your defibrillator. So we're going to pull out that 33262, which is your answer. And that's it. So I hope I did not confuse you guys on that one, but I think you all are getting it. So let me know if you have any questions before we move on. Got it? All right. Sounds good. Okay. And for this next one, I'm gonna have to put, are you up for reading, Miss Angela? I'm gonna have to make you work hard for this one. And coders, don't get intimidated, okay? Just try your best, and remember, stick to your keyword and your steps, okay? You need to get through this because you're gonna get one of these in your CPC exam. So take a deep breath, and Miss Angela, thank you for
No
doing the honors.
problem. Coders are not as bad as they look, I promise. Okay, so let's go ahead and do it. A33405, 33533, modifier 51, 33517. B 33405, 33533, modifier 51, 33517, 35600. C 33405, 33533, modifier 51, 33510, 35500. D 33411, 33533, modifier 51, 33517, and 35600. Preoperative diagnosis: aortic valve stenosis with coronary artery disease associated with congestive heart failure. Postoperative diagnosis: same. Anesthesia: general endotracheal. Incision: median sternotomy. Description of procedure: the patient was brought to the operating room and placed in supine position. After the patient was prepared, median sternotomy incision was carried out, and conduits were taken from the left arm as well as the right thigh. She was cannulated after the aorta and atrium were exposed and after full hypernization. She went on cardiopulmonary bypass, and the aortic cross clamp was applied. Cardioplegia was delivered through the coronary sinuses in a retrograde manner. The patient was cooled to 32 degrees. Iced slush was applied to the heart. The aortic valve was then exposed through the aortic root by transverse incision. The valve leaflets were removed, and the 23 St. Jude mechanical valve was secured into position by circumferential pleated sutures. At this point, aortotomy was closed. Attention was turned to the coronary arteries. The first obtuse marginal artery was a very large target, and the vein graft to this target indeed produced an excellent amount of flow. Proximal anastomosis was then carried out to the foot of the aorta. The radial artery was anastomosed to the left anterior descending artery targeted in an end-to-side manner. The proximal anastomosis was then carried out to the root of the aorta. The patient came off cardiopulmonary bypass after aortic cross clamp was released. She was adequately warmed. Protamine was given without adverse effect. Sternal closure was then done using wires. The subcutaneous layers were closed using Vicryl suture. The skin was approximated using staples. What are the CPT codes? Okay, coders, I'm going to go ahead and give you 3 minutes on this one. And remember, use your keywords. Good luck, coders. Okay, coders, that's 3 minutes. Do you think we should give them more time?
Yes, please, Miss Angela. Can we give them
Okay.
a minute more, please? Thank
Yeah,
you.
this one's a long one. I'll go ahead and put a minute more on the timer.
Thank you.
Okay, coders, that's another minute.
All right. Thank you, Miss Angela. I'm just going to watch you guys here in the chat. I'm seeing you all are putting in your answers. I'll actually give you just 30 seconds to do that. And this is worth your time, so that's okay. So I'll put in 30 seconds and I'll be right back. But go ahead and just put your answers in. Don't overthink it anymore, okay? All right, that's it. So everybody got their answers in. Yeah, that's true. You definitely have to breathe for this one and then just, there's no way around it, really. Just have to rely on your FTR on this one and your keywords, of course. So let's see here. Okay, I'm seeing, wow, I do have to shout out to those who got this one. So Sarmi, that's wonderful. Haji, great job. Brittany, wow, Brittany, Miss Patricia, woohoo! Angela, hey Angela, Lavon, you got it. Wow, I am so impressed. Some of you are almost there, really close. I promise you. So I am proud of every one of you tonight, and if just for trying, really, that's an A plus for me. But let's go ahead and try and take a look. And like I said, this is the place where we make our mistakes, so we can learn from here and you do not make that mistake when you are in your CPC exam. So like I said, you all did great on this one. Now again, there's no way around it. If you are thrown in a scenario as long as this, I'm telling you guys, you might be thrown a scenario even longer as this one. So just don't don't worry about it. Take a deep breath and we are going to walk through it, okay? So that's what we're gonna do. And the answer is dun, 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 the answer for this one is going to be B. So for those of you who got it, great job, like I said. But if you missed it and you're going to learn something, which I'm gonna try my best, then that would be priceless. So yay! So shall we say we'll go over our keywords now, everybody? And I'm saying I really appreciate everyone who actually included your keywords here. So imagine that time you are solving the scenario and putting in your keywords as well. You are really practicing on banking in your timing too while you're doing this. So that's good practice. So keep it up, okay? So let's go over my keywords. I have preoperative diagnosis. Usually we do not highlight them. I don't even see ICD-10 CM codes, but sometimes when it comes to cardio, I kind of like go overboard a little bit because I might need those information. And since the post-operative diagnosis is the same, so I actually highlighted them as well. Okay, so the incision, of course, we're told that this is by median sternotomy. Now, if I look here, if I read through here, because if I look here and my answer choices, it looks like I'm coding for cabbage, and something about here I'm not familiar with, but there's another procedure that might have been involved in this scenario. So if I look at the description of the procedure, the first thing here, the first few sentences, it talk about the sternotomy, which already we know that we already highlighted it. So I just gonna not pay too much attention to here. What I'm gonna do is pay attention to this second paragraph. So this is when that procedure already started. So I kind of like to minimize my keyword when it's long scenario. Otherwise, I really is it's just counterproductive for me if I have too many information and I cannot make anything up from it. So we're gonna first focus on this one. So what happened here is that this patient was in cardiopulmonary bypass. So we know that for sure is important. We have an aortic cross clamp, whatever that is. We need that. We have a retrograde. We have an aortic valve. So there, boom, that's definitely a keyword.
Uh-oh, I think we might have lost her. Give her a second, guys.
Me.
Miss Rochelle, you're kind of breaking in and out there.
Okay.
Can kind of hear you. Oh.
Hold on a second.
Oh,
Can
there
you
you
hear
are.
me? Can you hear
I can
me?
hear you now. Yes.
I'm sorry about that. I think my I got disconnected somehow. The webinar kind of kicked me out. But I didn't touch it, so it just came back. I'm sorry about that. Do you hear me okay now, Miss Angela?
Yes, you sound crystal clear now.
Okay, I'm gonna try not to move and say a little prayer here. Thank you. And coders, I'm sorry about that. Where was I? So I was talking about this paragraph here. So I kind of skipped on this the upper part because it only talk about the incision, and I already had the information there. So what I was talking about earlier, I think when I was cut off, is that I kind of focus at this because if I look at my answer choices, it looks like I'm coding for cabbage. That those answers are familiar to me, and those are actually probably would be familiar to you as well. But these first codes are not familiar to me at all, so I don't know what that is. So I know that I'm coding for some other procedure in addition to cabbage there. So this is what I'm going to focus on. So this talk about a cardiopulmonary bypass. We have an aortic cross clamp. Then we have a retrograde. That is another keyword there. We have an aortic valve. Definitely we need this to code because this is a location. We have transverse incision there. Valve leaflets removed. So there, that is a procedure. So it involves a valve leaflet removal. And we are given a 23 St. Jode mechanical valve. Okay, so this looks like a procedure to me. So I'm actually going to cut it off here and tabulate, okay? To make it easier for me, what do I get from this part here? I know that it involves a valve leaflet removed and then that mechanical valve. So I actually already went ahead and put it in there, but what I got so far, I said, is in there. And it talk about bypass and how was sternotomy incision open. So I just pick up the things that I needed. So I put it there and I color coded it. All right. And everybody is following me in this one so far. So the one I needed this because this is not about a cabbage procedure. So making it easier, right? Okay, everybody's saying yes, so that's good. So now I'm gonna focus here now. So there's more here because the attention was turned into the coronary artery. So they have another focus there, another procedure they're doing. Then we have the first obtuse marginal artery. We have a vein graft. So now that they talk about graft, that confirms, okay, they're talking about vein graft. So this is where my cabbage is going to be, all my information for cabbage is going to be coming from. So we have a proximal anastomosis, we have aorta. Okay, we have the radial artery, and we know from our keywords and our FDR that we need the information, the radial artery, because that usually is for being harvested, right? And that is indeed anastomosed, meaning that they sew it together to the left anterior descending artery. Proximal anastomosis to the aorta. So what do I get from this? So I'm going to focus my attention here. So it talk about a vein graft and a radial artery, right? So if you look at our keywords, so what type of cabbage are we coding for here? Did everybody determine that? Let me know in the chat. I want everybody to actually, we're gonna go through this like elementary style. All right. I like your answer, Brittany, Miss Patricia. Anyone else? So whenever your scenario involves a vein graft and the harvest was an artery and it was being anastomosed in the left anterior descending artery. Yes, yes. Now I'm seeing more answers coming through. And that means that we are actually coding for combo. So the vein graft there and to the aorta, and then we have your left anterior descending artery. So that involves both, okay? So following through your FTR, I'm just going to cut it short here. We know that we are coding for a combo. Looks like one for vein and one artery graft. Okay, remember that, and the anastomose to the artery, and one is directly to the aorta. And we have a harvest too because it mentioned about a radial artery. And if you actually look at your FTR, you might be able to get a head start because we already know the code for the radial artery um, harvest. That would be 35600. Any answers here that does not have that harvest, you are actually able to eliminate it from there. You guys remember that? So that kind of makes it easy too. But we're just going to walk through this. And finally, remember, if you're coding for combo, you have to code first the artery. So those are the things that we need to pay attention to. Now, look here. I'm not pulling any more keywords from here because this is talking about closure. So I do not need any of these vicarial, protamine, and all that. That will just confuse me. So everything I got as far as my keywords, I simplified them. And now I can focus on this and then I can code it. So let me know if you're following along at this point before I move on to the next slide. Okay, good. Sounds good. Thank you. All right, so let's go ahead. So now we know women business. So we know that we're coding for this prosthetic, the mechanical valve via bypass. So I found this pretty cool. I'm not pretty sure if it's accurate pertaining to our scenario, but just to show you, I found this St. Jude aortic valve illustration there. So it might helpful for you guys. So basically they put it in there um in your aortic valve. This is actually a prosthetic valve. So if you distinguish that St. Jude, that sounds commercial. So it's not from a, you know, from a pig or what was that for a pig? I forgot. I actually had that beef. I was gonna mention that, but now I forgot. Sorry. But this is like a prosthetic one. So if you look at 334045, the replacement, you have it there in your code description, aortic valve open with cardiopulmonary bypass with prosthetic valve other than a homograph or a stentless valve. So all of this fits in our scenario because we're looking for a prosthetic valve, right? The aorta, the location is correct, and it talks about your cardiopulmonary bypass. So remember, if you pull that information earlier, you know that we had this was done by a bypass. So we like this. Now, comparing that to the other first listed code 33411, this is coding for aortic valve for non-coronary sinus with aortic annulus enlargement. So there was nowhere mentioned about an annulus enlargement. So even if we're not very savvy, with all these procedures, but we know for sure that we did not see those language there. So between the two, we know that 33405 matches. So we're going to go ahead and get rid of D. Okay. Everyone following? I didn't think anybody chose D. So I think we're good on that one. So I'm going to eliminate D. And remember, now we're talking about cabbage. This should be easy for you guys. So remember, we know that we're coding for a combo. And the rule is when we're coding for combo code, you have to code first the artery. So we know there's one artery, and that should be coded from 33533, coronary artery bypass using artery for single arterial graft. So it all matches. Plus, remember, when you're coding for combo again, you cannot use the code for the vein. You have to code the combo code, which is going to come from this family, the 33517 family. And you will notice that it is an add-on code, which means that it has to be coded along with your arterial graft, okay? And you can read that here in your code description: coronary artery bypass, using a venous graft and arterial graft. But this is for for veins, but it has to be coded only when your cabbage involves an arterial graft along with it. So a combo code. So with that being said, we know that we're only coding for vein. That will make it, remember that I said about that 33510? This is coding for a vein only. Okay, so that's the difference between these codes. Both of them are for veins, but again, the add-on code is for a combo. This family code is only, you code this when your cabbage involves veins only. Okay, so this is going to be your code. So because we are coding for combo, we eliminate. And you probably already eliminated this long ago because the radial artery is going to be coded because that is an upper extremity, and the code for that is 35600. Okay, so that is why your answer is B. All right, I'm ready for your questions, coders. Go ahead and fire it up. I'm ready to answer them, and I'm going to try my best, because I think we did have quite a mix of answer here. But if you got it and say, okay, Mr. Shell, boom, I got it. I rocked this one. All right, looks like Miss Angeli got it. Miss Kelly got it also. Yeah, I saw that, Brittany. You definitely rocked this one. Katoya, all right. Oh, wow. It looks like everyone got it now. So I am so impressed. So thank you. All righty then, let's get moving to the next one. All right, Miss Josie, it's going to be your turn if you're still up for it.
Yes, I am.
Thank you.
All right, coders. We'll start with the answers first. A is 36561, B 36563, C 36560, and D 36558. A physician places a centrally inserted tunneled central venous access device with a subcutaneous pump in a 7-year-old patient. What is your code? Coders, your time is 2.5 minutes. All right, coders, that was time. It seems like we're sprinkled a little bit everywhere, Miss Rochelle.
I see that too. All right. Okay. So don't worry. We're going to talk about this. And thank you, Miss Josie. Enjoy the rest of your night. And
Thank
thank you
you, and
for
thank you,
helping
coders.
us out. Have
You're
a lovely
welcome.
evening, Miss Josie.
Thank you.
All right, coders. So let's take a look at this one. Like Miss Josie said, we do have some varying answers here. I'm seeing a lot of A's, a few C's, and a few, well, a good amount of B's. So let's take a look at this one together. So the answer is B. So if you answered B, then you are, as Mrs. J would say, outstanding. And if you missed it, well, we are going to learn something tonight. And I think after this one, hopefully you will not make the mistake again. So we know that we are coding for a centrally inserted tunneled central venous access device with subcutaneous. Okay, don't my own clicks were off. So centrally inserted, we have tunneled central venous access device with subcutaneous, so that should be highlighted, pump in a 7-year-old. So if you remember when you're coding for peripheral, this um under this code range, I would just say that it's really important that you pay attention to the age. You also have to pay attention to what type of device you're coding for. And of course, the how, the access, how was it accessed, okay? And this is the illustration I was talking to you about, a really good visual to determine the difference between a tunneled central venous access device. So this is your tunneled. Now a central um, I'm just going to say this. So as you can see here, for both of them, the tunneled and the non-tunneled, they're usually a central access device. So meaning to say that they directly access your veins or your artery, whatever that is, um, on the central part of your body. So usually on the chest area. Okay, so that's the difference, because when you're talking about a peripherally inserted catheter, that would be peripheral, meaning to say on your extremity. Sometimes they put it on your arms, sometimes it can be on your leg, but anything that's on your extremity, that's going to be referred to as peripheral. So that is your PICC, okay? Does that make sense, everyone? So that's the main distinguishing factor between the two. Now, if you're talking about central access device, there's two types of them. We have a tunneled and a non-tunneled. So basically the tunneled, this is usually involves like a port or a pump, because this is intended for a long-term use. So usually I would say, for example, like a cancer patient who are receiving treatments. So usually they would do this, tunnel central line, and they will actually leave that on a patient, so then they won't have to keep poking the patient every time for treatment, and the fluids that they have to take, whatever that is. So usually it will stay on that patient's chest area, and they will tunnel it. That's why they call it tunnel. So they actually kind of tunnel it under your skin, like so. Whereas non-tunnel catheterization is usually when they use it when for emergency purposes, or sometimes when they have to give treatment directly to your vein, like such. But usually this is not intended for long-term use, so usually they just take it out. So it's really not tunneled into your screen. So this is not, it's not going to stay in your body for a while, as a tunnel do. And if you're wondering what a port looks like, it looks like that. A little thing over there. Okay. All right. Okay. So let me know if you guys got your screenshot on this one. I hope this is helpful, but let's go back to our scenario. So again, we know that we're coding for centrally inserted tunnel, central venous device. Remember, we're coding for pump. So if you look at 36560, okay, that's your parent code for 36561. So I want you all to look at this and tell me what's wrong with this. Okay, so we know this is for a centrally inserted venous access device, but what keyword here in this description that makes this wrong? Because I want to make sure that you guys are going to learn from your mistake. Yes. Okay, yes. This is coding for a port, okay? So if you look back, we were coding for a subcutaneous pump. So anything that comes from this family is going to be wrong, okay? So even though this is coding for younger than 5 years, this one is age 5 years or older. However, again, because this is for a subcutaneous port, we cannot code from here. And we eliminate both of them, okay? All right, so that's why we eliminate B and C. And then we're going to move along to 36563. Actually, I'm going to go with 36558 first. Again, another tunneled, centrally inserted venous catheter. But this is talking about without subcutaneous port or pump. So it's not even about, it's not even a subcutaneous port or pump here. So basically, it's just a catheter. Okay, so again, because we're looking for a subcutaneous pump, we cannot code from here as well. So that would eliminate D. Right? Following along. And finally, yes, now that we're here, 36563, insertion of a tunnel centrally inserted central venous access device. And look at that. There it is, our subcutaneous pump. Then you know that this is going to be a right code. So it might be helpful that you chant this. Make sure that you might pull that language here without port or pump. This one is subcutaneous pump, something like that. Make it stand out. Or if you want to box it, underline it, something like that, because it kind of looks the same, especially if you're in a rush. So let me know if that's helpful to you. Meanwhile, I'm going to take you to the chart again because you know I like the charts. It's probably wrong. I hope it's not the wrong page, but this is the new one. I don't really like it. The color thing kind of bothers me a little bit, but in order for us to use this, basically we're just again follow our our keywords. So here is your central tunnel devices here in this column, and we're looking for a device. Okay, so we're just gonna pick up there 36563. This is your tunnel. Now remember, we're looking for a pump. Actually, this should be here 36563 with pump. Okay, so sorry, I went too far. So your code anywhere is still here. So if you notice, it's not even about the age for this one. For the device, it's all about whether if you're coding for port or pump. Okay, because here if you look, there's such codes for port and pump, which we eliminated earlier. All right, coders, tell me what you think about this one. Did you learn something? Do you have any questions at all? Or if you got it, say ice cream. I'm kidding. Or say let's rock and roll. Okay, I'm seeing got it now. So yay. All right. Sounds good. I'm seeing ice cream. Oh my goodness. Thank you, Katoya. All right. Y'all are so fun. Okay, so let's go ahead get moving. And I am actually ask you, Miss Angela, if you can read the next one for us, please.
Of course.
Thank you.
Okay, so here we have our answers. A, 36200, 75630, modifier 26. B, 36200, 75625, modifier 26. 75716, modifier 26. C, 36200, 75625, modifier 26. 75710, modifier 50, and modifier 26. D, 36200 and 75716, modifier 26. Aortography and bilateral extremity angiography was performed. The physician placed the catheter in the aorta at the level of the renal arteries and injected contrast for the aortography and repositioned the catheter just above the bifurcation for angiography of the lower extremities. Which CPT codes are reported? I'll give you guys 2.5 minutes on this one. I'll go ahead and start the timer right now. Good luck, coders. Okay, that's 2.5 minutes, but I think maybe I can give you guys another minute on this one. What do you think, Miss Rochelle?
Yes, yes, that sounds really good, Miss Angela. Can we do that, please?
Okay.
Thank you.
Yes, of course. Okay, I'll start the timer right now. Okay, coders, that's time.
All right, thank you, Miss Angela. Okay, it seems like we're split on this one. Banana split. Okay, I'm messing around here, coders. So get your answers in. I know you guys are trying on this one, so I really want to make sure everybody gets a chance. And like I said, I'm gonna try make this make sense for you. And I found a good visuals on this one as well that I'm hoping that would help. So okay, and great job on those keywords. I love them. Great, great, great. Okay, so like I said, it looks like we are torn between B and D on this one. So let's go ahead and take a look. So let's start first. The answer is actually B. So if you got it, way to go. So you probably answered, probably practiced already by now. So that's why you're so good at this. If you missed this, so I'm going to try. Let's go ahead and take a closer look at this one, okay? So we have the orthography, we have bilateral extremity angiography there, catheter in the aorta. Those are really important when you're coding for these catheterizations. We have the renal artery, because these are the location that really kind of puts everything in perspective so you know where to code. Okay, of course, angiography, and angiography involves contrast, of course. So contrast for orthography, reposition the catheter just above the bifurcation, and an angiography of the lower extremities are done. So those are my keywords, and those are the things that I need in coding this. Okay, now I'm actually going to show you this first illustration there. So I'm going to put it in perspective of, visuals here, just so that we can imagine it. If I find it easier if I can imagine it, what they're talking, however complicated they are, just a little bit of visual would help me understand it. So I'm hoping that this will too for you. So what we know is that we have an orthography. So we all know what orthography, right? So an orthography basically is an X-ray of an aorta. So as long as the imaging and the catheter stayed in the aorta, we call that as orthography. So we're gonna trace back in our keywords. We have orthography there, and the physician placed the catheter in the aorta. Okay, so we did have an aortography here. Basically, it was actually straightforward given to us that there was an aortography done in the aorta. So when they accessed the vein, it was indicated where, but they are telling us that there was aortography in the renal arteries, meaning to say that this catheter just stayed in this aorta. Remember, the aorta kind of is like a hook, a long, I would say like a hook, or like a, uh, a candy cane, like so. So as long as the catheter stayed in the aorta and they did an imaging in there, that is going to be an aortography, and there is a separate code for that. Okay. But we did have some more, because if you look here, down here in the description and the scenario, they actually moved that catheter down to the bifurcation, and they actually perform an angiography of the lower extremity. So where would your lower extremities be? That would be here. So meaning to say that they actually went into your vessels now. So it actually moved from your aorta and went to the vessels. Okay, so they now have results in your lower extremity, and we call that, remember, when you are x-ray on the vessels, blood vessels, is called angiography, right? Okay, so does that make sense, you guys? So if you really put it in perspective, there's two imaging types of imaging performed in this one scenario. We have the aortography in the renal artery here. When that catheter stayed in the aorta, we call that aortography. Now, when they moved it down to the extremities, that is now called as angiography, because that involves the vessels. Okay, that's one thing. All right, making sense? And I have one more actually, just to kind of confirm what I'm telling you about. Okay, so if you have your screenshot here, and I'm going to move it here, we're going to leave on this scenario first. It doesn't pertain to this scenario. Sorry about that. Doesn't pertain to this scenario, but I just want to show you what an imaging of an aortography would look like, and that would look like this. So see this imaging here? It is only focused on the aorta. Okay, so if you see that, that's the renal artery. So basically, that's what they're going to get. Okay. Now, comparing to an angiography, the focus on that contrast is actually that contrast material is actually going through your veins, or the vessels. Okay, so see that it's smaller, so that would be angiography. Okay. All right. Tell me what you think. Does that clear it up a little bit for you guys? All right, I'm seeing yes. Any questions before we get back to those scenario? Okay, good, good. Seeing yes, yes. All right. So now that we know that, then we can code this easily. So the first thing, of course, when we're coding for this, definitely you have to code for the catheterization. And luckily for us, we know that, the introduction of the catheter is in the aorta and it stayed in the aorta. So we have to code that as 36200. Okay, and everything has a 36200, so that's good. So what really drives this is that angiography code, whether the orthography and of course the angiography. So 75625, this is your aortography code for abdominal. Okay, we like this because your renal artery actually is in the abdominal aorta, right? Your renal arteries, or in your renal, when they put the aorta at the level of renal arteries, it stayed in the aorta, but in the level of renal arteries, so that would be abdominal, of course. So we like this one, but we eliminated 75630 on A because this is including bilateral iliofemoral lower extremity. Again, remember they moved that catheter actually. I mean there's a different code for that lower extremity. We call that angiography. It's not going to be orthography. Okay, so we're going to eliminate A. And also here, if you look at 75710, which you can see on C, angiography extremity, but this is for unilateral. It's talking about lower extremities, meaning both of them, that would be 2. So we have to go ahead and eliminate C. Okay. 75716, you can see that in both B and D, and this is where we kind of like got confused. This is angiography, extremity, bilateral. So this is actually coding for your angiography. However, you are just basically missing here for the aortography. So don't forget about the aortography. So we're going to have to eliminate D because, like I said, there was 2 imaging performed here. One is aortography and one is angio. Okay. And that's just it. So once you get your the hang of it, then you will know how to code it next time, I believe. So let me go ahead and take a quick peek in the chat here. What do you guys think on that one? I'm seeing got it already. That sounds really good to me. All right. Okay. So I'm seeing got it. So let's see. We'll have one more for the night. And I'm going to let you go to enjoy the rest of your evening. Does that sound good to everyone? Oh, you're ready to go home now. All right, I'm seeing yes. So let's do it. It's just easy one for this last one. So I'm just gonna go ahead and read this. We have A 36600, B 36620, C 36625, and D 36640. And arterial catheterization is performed by cut down for transfusion. What CPT code is reported? And I'll give you let's try 2 minutes on this one. Again, this is easy and your time starts now. All right, get your answers in. I'm seeing great answers here. Woohoo! Way to go, Sarmi, Kelly, Brittany, Haji, Miss Francine, Lavon, Joni. Hi, Althea. I didn't even know you're here. Thanks for being here. It's always wonderful to have you and Angela here. And you all, both of you are correct. Great job. Miss Patricia. Woohoo. And some of you are changing answers. So I think by now we have 100%. So let's go ahead for the time's sake, because I don't want to be, taking too much of your time. This one is pretty straightforward. We have arterial catheterization by cut down transfusion. The answer leads us to C just by going into, our keywords. So we know that we're coding for cut down transfusion. 36600 is coding for arterial puncture without for withdrawal of blood for diagnosis. This is not specifically what we're looking for. Ours is for cut down transfusion. So we're not going to be coding that because 36620 is a better code. We see all of our keywords here. You have your transfusion, and this is a separate procedure. So we like, but sorry, get ahead of myself. 36220 is for percutaneous, but we are looking for a cut down. So we're going to have to pick from, the indented code or the from the family. 36625 is our code for this for cut down, and we'll eliminate 36640 because this is for chemotherapy, and that leads us to answer C. Great job, coders. And with that being said, unless you have questions, I want to make sure, don't forget what we learned tonight is that remember always when you're coding cabbage, get a heads up. Always identify your harvest so that you can get a heads up and maybe eliminate your answers. Know your radial artery. What I would suggest to memorize this by heart, only a few. So you can see them, right away and eliminate answers. So your code for radial artery, your code for vein, and for your FEMPA. That would be a good advantage. Also, don't forget when you're coding for a combo for cabbage, you have to code the arteries first and always use the combo code for veins. Okay, that add-on code should be where you're going to and not the cabbage procedure for veins only. And remember to read your parenthetical guidelines because they are the supreme guidelines. And keyword concept, of course, as you know, helped us out tonight. So I hope that you learned something from tonight's class. I want to take this moment to thank you for all your effort tonight. Thank you for joining us. And you all are outstanding. Don't forget to leave us a feedback. And Miss Angela, thank you so much for all your help. I really appreciate you. Miss Josie, if you're listening in, thank you again. And Miss Al, we miss you, Miss Al. Okay, and if you have any questions, go right ahead and type them in the chat. Miss Angela, do you have anything to say?
I do. Coders, you guys are amazing tonight. Just keep coming to the studies. They'll definitely help you improve and get better and better. And I'm so glad I could be a part of this. Thank you, Miss Rochelle.
Oh, it's my pleasure. Thank you, Miss Angela. I hope you're joining us again on Wednesday. And coders, you too. Hoping to see you. It's going to be fun. I love digestive.
I'll
So,
be here.
yay. Yay. Thank you. And enjoy some ice cream and some chips. Actually, Miss Angela has a good trick has recommendations for me I need to read. Right now I'm gonna actually stop the recording. I do have one question that I need to address here. So if you are good to go, enjoy the rest of your night, and like I said, come back to us on Wednesday. And good night. And I'm gonna be with you, Miss